We have a very full agenda today. My name's Aaron Levo. I'm the Vice President of Communications and Public Affairs at Hamilton Health Sciences. Pleased as always to be playing a moderating role for today's town hall. We will have a Q&A today. We may run out of time for a fulsome Q&A at the end as we normally would do, where people ask questions live, but I'd still encourage everyone to try and enter your questions as we go using the Q&A function at the bottom of your screen. And our panelists do an excellent job at answering questions as we go. And you can review those answers in the answered tab that's in that Q&A function. So again, that'll be a really great way for us to try and ensure that we're responding to people's questions, but at the same time, we might run out of a bit of time at the end because I know we've got a lot to cover today. So why don't I toss it over to Rob McIsaac, our President and CEO, who will give us an overview of today's presentation. Rob, over to you.
Thanks very much, Aaron. And hi, everybody. Thanks for joining our last town hall this month. We continue to recognize June as Indigenous History Month. And so I want to note that we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. You know, the tragedy of residential schools continues to impact our community, and the discovery this week of the remains of more children in unmarked graves in Saskatchewan once again, I think, points to the painful history that Indigenous peoples have experienced and continue to be impacted by. So to those who within our communities, our hospital community, who are struggling, please totally encourage you to reach out to somebody you trust or use the resources available through the Employee Assistance Program. And to everyone else, please be kind to your coworkers and your neighbors. You're encouraged to visit the HHS Hub to learn more about our land acknowledgement and for resources and learning opportunities to support the ongoing effort to improve Indigenous care and services across the hospital. I also want to remind you that you can view and share the recordings of this month's previous town halls or presentations about Pride Month and Indigenous History Month and Indigenous Peoples Day. I think we continue to be early in our journey to eliminate prejudice and discrimination at HHS, but we're fully committed to creating a hospital where everybody feels welcome and safe and respected. I'm very appreciative to all of you who are embracing this work. I also want to bring attention to the STAR recognition activities, which have been underway throughout the month of June. This week, we're continuing to say thanks to everybody at HHS for all that's been done with the distribution of lanyards and gift cards and other special treats across our sites for staff, physicians, and learners. Information will be shared through the daily dispatch, and you can also connect with your leader for more details. I would also invite you to consider sending an e-card to a colleague using the STAR cards available on the Hub. It's a nice kind of surprise that you can give to somebody in their day. So think about taking a moment to send a personal greeting to a coworker. These small gestures of kindness, I think, go a long way. I'd also like to call your attention to this year's community report called Rising Up in the Environment Performance Report, which were made available last Friday. This community report documents our leadership role during the pandemic and the many achievements that we've made even during this global health crisis. The environmental report recognizes the measures we're taking to be better stewards of our resources here at Hamilton Health Sciences. So for sure, it was a year like no other, but I also really think we have a team at Hamilton Health Sciences like no other. And you should all be super proud of what we accomplished together. We're going to take a few minutes to celebrate some of those accomplishments that are captured in those two reports a little later in today's presentation. As we start to shift our attention to pandemic recovery from pandemic response, I also want to remind you to take the time to complete a national survey that we are participating in called Employee Wellbeing During Times of COVID-19. HHS will only receive results in aggregate form from the study if a minimum of 1,000 HHS staff, physicians, and learners participate. So the link to that survey was shared via a communication from Kirsten Krull and Dr. Andrea Frolick last week, and it continues to be available on the hub. The link to the survey will be open until July the 12th. So you have a little bit more time, but it would be really helpful for folks to participate in the survey. The learnings from it will help us to better understand how everyone is doing and what we can do to better support our collective recovery from the pandemic. I know that we still have a lot of work to do to return our services back to a steady state, but I'm encouraged by the progress we're making even in these early days. More and more staff are returning to their home units. Visitor guidelines are changing, and the number of cases that we're seeing continues to diminish. Our role as a regional center for ECMO continues. We're still caring for patients from elsewhere in the province. We're also keeping an eye on the Delta variant. Planning continues locally, regionally, and provincially to help further stabilize our healthcare system and improve our ability to recover. So we'll continue to share updates regularly through our various communication channels. With regard to these weekly town halls, we are going to slow down the frequency from every week as I think the need for critical pandemic-related communication stabilizes, and our work focuses more on recovery than response. Our next town hall will take place on Thursday, July the 8th, so there'll be a bit of a break. And finally, as always, I want to encourage those of you who have not yet done so to please get vaccinated as quickly as possible. And please remember to self-report your vaccination status to Employee Health Services. So thanks all for your ongoing efforts to meet the needs of our patients, and I will turn it back to Aaron.
Thanks, Rob. So next up is our operations update from Sharon Pearson, our Chief Operating Officer and EVP Clinical Operations. Sharon, where are we at this week?
Hi, thanks, Aaron. Good afternoon, everyone. And just a brief update today on our operational situation at HHS. And as Rob indicated, our numbers are declining as they are across the country and across the province. And today within the ICU as a total, there's 78 patients. Just a reminder that we have a base of beds in the ICU of 88. And in terms of those with COVID or COVID-related illness still in the ICU, there's 17 patients. And it's really important we also account for those individuals that have COVID-related critical illness because there is still care to be provided for that population and a need to resource the ICU to care for that population as well. In terms of the ward level patients at this time, there's only 4 across our organization, and we've seen a significant decline, which is very fortunate, on the volume of patients that require ECMO. And that number today is sitting at 5, but we continue to ensure that we meet our obligation to have that capacity available for the province. As a result of the census balancing that occurred over the course of primarily wave 3, we still have patients out of region within our care, and we will work with their home hospitals to repatriate when the patients are stable to do so and when those hospitals are able to accept. As far as other operations within the hospital, our ED volumes remain constant. We are starting to see that incline in our ALC numbers that we had anticipated would happen as the capacity in the long-term care home continues to increase. And if we could go to the next slide, We updated last week on where we are at with our ramp up activity. Some good news to report this week in that we're up to 80% of our pre-COVID volumes for surgical care and 74% for our procedural care. So that's fabulous. I already highlighted some of the pressures that impact our ability to ramp up are related to the requirement to maintain critical care capacity. All hospitals are required to do this within the province, as well as our unique requirement related to ECMO. And again, we have finite resources to manage this additional capacity, which is why we continue to require some of those deployed staff to maintain, so we are able, if necessary, to continue to ramp up. And of course, working with our partners on that process. Just to put the number there so folks realize what's ahead of us, there's a significant surgical backlog across the country. Within our province, there's over or close to 500,000 cases. For HHS, our surgical backlog is 5,600 cases. So lots of planning around how we will try to address this deferred care over the course of the upcoming months and year, and probably into years. And just an update on where we're at with the redeployed staff. 147 have now returned to their home units, which is wonderful. We still have approximately 60 that are working across the organization to help us address the impacts of COVID. So again, thanks to that group. Happy to take questions, but we'll turn it back to Aaron.
Thanks very much, Sharon. Just a reminder to everybody, we do have a packed agenda today, so you can post questions in the Q&A function at the bottom of your page. We'll do our best to get through those as we proceed. Next up is our Medical Director of Infection Prevention and Control, Dr. Dominic Mertz, to tell us a bit about how the pandemic's progressing or regressing, as it were, across the country. So Dominic, where do things sit?
Yeah, thanks, Aaron. I was asked to keep it short today, so less slides than usual. I only show you the status as per a couple of days ago. You see Yukon is struggling right now. It's the P1 variant there, so one that didn't really push through in our region, the one from originally Brazil. Otherwise, you see all the large provinces are continuing to come down with their case numbers, with RT values typically below 0.8 or at least below 0.9. So still significant decline in case numbers across the board. All the other territories, as you can see, currently COVID-free. Compared to last year, as a country, we are sitting pretty much where we had been a year ago. Next slide. That's a provincial view, similar here, pretty much in terms of cases per 100,000 per week to where we've been last year around the same time of the year. Significant decrease in case numbers over the last 10 weeks since we peaked back then. Next slide. What's the difference to the same time in 2020? We certainly have an issue that we haven't had a year ago, which are the Alpha and Delta variants, which both are more transmissible, Delta even more so than Alpha, as you know. On the other hand, we have fully vaccinated hospital staff. The ones who aren't fully vaccinated, it's first and foremost, or was their choice, but everyone should have had a chance at this point to be fully vaccinated. And outside of the hospital, we now have 77% roughly of adults with at least one dose and 29% adults fully vaccinated. Very different from a year ago, where we pretty much had zero immunity out in the community, which will help us deal with those Alpha and more the Delta variants that we encounter. Next slide. In terms of hospital admissions, again, similar picture, similar to where we've been back in June or early spring 2020, when we slowly went into the second wave, where we are still higher, and that's not a surprise after what you've heard previously, still higher than where we had been in terms of ICU admissions at the provincial level. Next slide. This is the modeling from May 20th. So you can see we still overperform and doing better than the best case scenario here with the green line, when you look at the red line, which is the actual numbers from week to week. Next slide. That's the more recent model from a couple of weeks ago with that wide range of plausible scenarios, from a very positive one in green to a not as great one in red, showing the uncertainty that we have with Delta at this point. But you also see, as a province, we are doing better than predicted, even in the best case scenario here. The next few weeks will be telling in terms of how we will be moving forward here. Next slide. ICU similar, very much in keeping with the latest model here, for the first time below 300 ICU or patients admitted in the ICU with active COVID at this point. So continue to be on the right track. And then you see that in 2-3 weeks, we may see again a difference in terms of trajectories based on what's happening with community transmission over the next few weeks, but still will be much, much lower than where we had been over the last couple of weeks. Next slide. This is where we stand in terms of Delta VOC, and you can look at the Ontario Science Table dashboard on a daily basis, and those numbers jump significantly in terms of what's the proportion of Delta in the province. And that's because it's an estimated number, because we have that delay by at least 1 to 2 weeks until we have those positives sequenced. Currently, we are probably sitting at roughly half as a province, but the good news you see at the top there, that even for the higher transmittable Delta, we have an R t-value of less than 1, which means that regardless of what the strain is, things are moving into the right direction still. Next slide. That's the Hamilton view. Again, we are similar to where we've been in June, but June there was our large retirement home outbreak, so not entirely comparable from that perspective. When we are looking at the modeling for the city, it looks like we will probably be hitting rock bottom with our current case numbers, and then either continue around what we currently have, with the worst case scenario expecting that number of cases per day may go up into the range of 40 per day again, which will translate for our healthcare system into best case scenario on average 1, worst case scenario on an average of 2 hospital admissions for Hamiltonians per day over the next couple of months. Next slide. Is our current hospital admission situation in Hamilton. Again, very similar to where we've been back in June 2020, but again, much, much higher proportion of ICU patients, as you know. Next slide. This is just the community cases, so excluding the outbreak, close contact cases, and so on, which we use for our policy making, because this is the number that in our mind best represents the risk of an average person walking to our hospital with no known exposures or no known outbreak setting that they would reside in. And you can see that, yeah, it came up slightly again, but we are in that 5 to 7 range while we have this threshold of 20. We wanted to wait 2 weeks after the reopening step. We achieved that in the next day or 2. We don't expect a major change, obviously, over those next couple of days. So next slide, the decision has been made that by Monday after the weekend, we will change the remaining policies into low epi as well. You remember we already changed the visitor policy to low epi. We stopped doing the asymptomatic testing in our oncology patients. The changes now, which are the last ones to get back into our low epi policies, will be to stop pre-procedural asymptomatic routine testing, with the exception, obviously, of patients who come from higher epi regions. For us, the only relevant at this point of time is the region of Waterloo, where we would still recommend to get them tested, because they would be above that 20 per 100,000 per week average in their public health unit currently, and no longer to require a test if symptoms can be explained by an alternative diagnosis. So that's your patient with fever, with appendicitis, where to date we would have said, no, nevertheless, go and test, where we wouldn't necessarily insist on that anymore. Next slide. And that's the summary, and this will be shared along with memos and the updated documents over the next few days, again with implementation by Monday. This is a great summary in my mind, showing what the changes are and what you have to keep in mind. Handing back to you, Aaron. Thank you very much.
Amazing. Thanks very much, Dr. Mertz. Next up on our agenda, we have Dr. Barry Lum, who's going to give us an update on the Odyssey project that's rolling out. Barry, what do we need to know this week?
Thanks, Aaron. Hi, everybody. You know, I think you've heard us say over and over again that Project Odyssey is one of the most important clinical transformations in the hospital's history, and really a critical patient safety initiative. So, you know, despite all of the chaos and the incredible amount of work that's been going on the COVID side of the house, we have been pushing forward as best we possibly can on Odyssey, and really are still driving towards our previous go live date. You'll see here the depiction of our kind of long and winding road towards go live at the end of phase 5. We're now in the middle, about 2/3 of the way through phase 2, which is this critical phase where we're going to put the HHS stamp on the EPIC Canadian Foundation and build the system designed to work in the HHS environment and the unique aspects of our institution. This will be followed, as you can see, by another critical phase of testing of the system and make sure we've got it right and all the tweaking that will be required. We are on time and on budget, and as of today, we are 344 days from go live. Next slide, please. So what's going on? As I said, we are in the middle of this current phase, what we call the build waves. We're approaching the end of build wave 3 tomorrow, and we are, for the most part, making very steady progress. The estimate is that we're making something like 140 decisions a day through that process, and of course, we have been somewhat significantly challenged really by the need to redeploy our nurses to the front line. We're very grateful that they're going to be coming back to us over the next week or so, and we can start to take advantage of their expertise. So we are continuing to move along. Within the Odyssey project, there's all kinds of work going on by the leadership and the subject matter experts on a whole variety of areas, a couple of which are highlighted here. One is the review of our device needs at every unit in every corner of the organization. That work is ongoing and will be a critical part of the next steps, as I'll show you when we get to the next slide. We're actively looking at training, even though it won't officially start for folks who are on the front line until next spring. The complexity around training the entire clinical staff at HHS, approaching 15,000 people, is a massive undertaking. And then there's another very important piece called clinical system design, which we are preparing for, and I'll mention again. And just a note of an example of a major step forward at the Juravinski. We are now moving to the installation of the new medication delivery devices called Omnicell, and as we retire the old devices. And this is all part of preparing us for strongly enhanced medication safety at the organization. Next slide, please. So as we move from planning within the Odyssey project, we will be coming to our clinical leaders, and that's at the manager, director, and really at the front line level to ask for your help as we move forward. Having done the device review, we're going to need to go to each unit and figure out where the devices need to be, when and how they're going to be deployed. As I mentioned, we're in the process of a very detailed review of the training curriculum, and we'll be looking to hire trainers in the next few months to begin to train them to train their colleagues in working and living in the EPIC world. We're in a very important phase of reviewing all of the order sets that exist within HHS. There'll be well over 200 that will need to be formally reviewed and integrated into the EPIC world. And then we have this piece called clinical system design, which is where it's really going to get real for people who are out there on the front line taking care of patients, and how each area with their own specialty will have the opportunity to make sure that the workflows that are relevant to them will be taken care of. So this is in areas where they might not be formally identified within the work groups. It will now get picked up and brought to the front line in the clinical system design. So there's lots and lots going on. And last slide, please. I just want to once again say thank you to everybody who's involved. It's a very busy but an incredibly exciting time. And just feel free to reach out to us anytime at Odyssey at hhs.ca. Thanks, Aaron.
Thanks very much, Barry. Great update. So next up on our agenda, I'll ask our President and CEO, Rob McIsaac, to join us again. Rob's going to walk us through a presentation outlining some of the highlights and achievements this year. By no means an exhaustive summary, but some of the things that we'd like to remark on. So Rob, over to you.
Yeah, thanks again, Aaron. It just, as we enter into the summer, I thought it was appropriate to sort of take stock and share some highlights from the past year. And these are outlined in our community report, but I just think as a group, it's neat to take a look at what we've been through over the past year and to do it, kind of assemble it all in one place. So let's do a run through of the year in chronological order. So starting last spring, the team across HHS mobilized quickly in response to the pandemic. A section of our Main Street West facility was quickly transformed into one of Hamilton's COVID assessment centers. So not only did we transform this physical space, we also collaborated with partners to support booking systems and lab testing and sharing results with patients. Since we opened the assessment center, it's been a 7-day-a-week operation staffed by our team. I think the spring was otherwise characterized by incredibly intense planning and organizational efforts, working both internally and externally to ensure we had the right structures in place to be able to respond to whatever the pandemic threw our way. In June, the pandemic led us to work with local partners in new and significant ways, including supporting individuals living in congregate settings with outbreaks. This work included accepting transfers of significant numbers of very sick patients from some facilities that were in crisis, often all of them showing up at the same time, as well as sending in teams of staff and physicians to support care in long-term and retirement homes at risk of failure. This required quick deployment of staff, not a lot of lead time or preparation because people's lives were in the balance. It was really difficult work, but our staff and our leaders were equal to the challenge as they worked through these difficult situations with external partners to provide support and care for those residents. Our infection prevention and control team members were also really critical to supporting all of these efforts during some very challenging and dynamic times. It was such an enormous challenge to be both learning about the virus and developing policy in real time to keep our staff safe, all in the context of a very unreliable PPE supply chain and PPE shortages. But again, the experience shows that our IPAC team consistently gave us great advice on how to cope with this really miserable situation. In July, although COVID continued to dominate our focus and the news last summer, we also took time to recognize some remarkable achievements. Our Hospital to Home program received the Canadian College of Health Leaders 2020 Excellence and Patient Experience Award. And sepsis research led by Dr. Alison Fox-Robichaud received a significant funding boost from the federal government, which I think is an important acknowledgement of Alison's hard work and her expertise in this field. In August, our cardiology team was the first in Canada to perform a life-saving cardiac valve repair procedure as part of an international study underway at a select group of hospitals in Canada, the United States, and Europe. This procedure would have been science fiction even 10 years ago, but with rapid advances in technology, the team is able to repair a tricuspid valve by delivering a device to the heart through the femoral vein in the leg and avoiding more invasive and traumatic surgery. This enabled people like Dave Watmore, who are experiencing weakness and an inability to do even modest exercise, to walk to their neighbor's house for a visit, even just days after undergoing the procedure. Last September, we created the President's Task Force on Equity, Diversity, and Inclusion. Equity, diversity, and inclusion has become a growing and important focus for HHS and reflects the broader concerns of our community in these areas. Its mandate is to create a framework for EDI that will identify and begin to address systemic discrimination and oppression of staff, physician, patients, family, caregivers in our community. Doctors Smita Halder and Sanjay Sharma, along with Bruce Squires, are leading this task force as co-chairs. And a diverse group of more than 50 people with strong connections to our community in various different ways have volunteered to help with this work, including clinical and admin staff, physicians and medical affairs, academic and research staff, and patient advisors. The President's team has been doing lots of work refining our approach to strategy deployment and the structure of our management system. Part of this work has been to designate the EDI task force's work as an enterprise project. This will give the project enhanced visibility and resource to the whole of the executive leadership team and to our board. In October, we also opened the new satellite health facility in a downtown hotel operated in collaboration with St. Joe's. The SHF has helped us preserve precious hospital space for those with urgent medical needs. We also see it as a critical part of our recovery strategy going forward. October also saw the stem cell transplantation and cellular therapies unit at the JHCC open. It is one of just 3 centers providing all forms of stem cell transplants to adult cancer patients in Ontario. And the new unit builds on Hamilton Health Sciences' expertise in the field of blood cancer treatment. In November, we celebrated being ranked as 4th for healthcare research in Canada. And we're super proud of the researchers working across HHS to advance care for patients and families, and also of our teams who are working to encourage patients to participate in research and integrate research outcomes into practice. Our team also supported patients with COVID through the launch of Connected Hamilton Health, a local partnership, providing remote home monitoring. Through this program, patients receive a health kit, including a tablet and data plan, blood pressure monitor, oximeter, and digital thermometer to record their vital signs daily from the comfort of their own homes. So This information is sent instantly to a nurse at the hospital's virtual command center and is used to support patient care plans. Research and innovation also came together as the first vaccine was approved for use in Canada in December of 2020. HHS mobilized to open the first vaccine clinic at our Wellington Street facility. In the early days of vaccine dissemination, only sites with these highly specialized freezers could be used for the vaccine, and that's why HHS was selected as one of only a handful of facilities in the province to launch vaccines in Ontario. Establishing this clinic in a matter of weeks required leadership from across our team, including clinical care, lab, pharmacy, HR, facilities, infection control, IT, procurement, communications, and lots more. While opening the clinic was really challenging work, it was the first really positive initiative that signaled a turning point in the battle against the pandemic. Amid this intense COVID work, planning for the installation of EPIC continued as we officially launched Project Odyssey with our workforce. As of this month, we're just a year away from flipping the switch on a brand new approach to management of our patient health records and how we interact with our patients and our partners. Our team also collaborated with St. Joe's and London Health Sciences to launch urgentcare.ca to promote virtual care for adults, children, and youth, and long-term care home residents. During COVID, this provides an option for patients and families who might have urgent care needs but are reluctant to seek care in person. It enables individuals to take that first step towards seeking care and linking them with other supports if they're needed. Another of our key transformation initiatives, ensuring we have the physical infrastructure to keep providing world-class care, continued to advance at an unprecedented pace. When we received $15 million from the province to continue planning for the new West Lincoln Memorial Hospital. So that's a major milestone. Healthcare is experiencing significant challenges when it comes to health human resource. I think everybody knows that. We were really pleased to be one of 12 hospitals to be selected by the province in January to participate in a new nursing extern program. The extern program is designed for hospitals to hire numerous nursing students who are in their third and fourth years of the BSCN program, and also nursing students in their final year of the practical nursing program. The nursing externs are able to experience all that HHS has to offer, hopefully influencing their visions for nursing jobs on graduation. Participating in this program also enhances patient experience by supplementing healthcare worker supports at the bedside. So it's an important recruitment tool for recruitment of the best and brightest nursing talent here to Hamilton Health Sciences. This spring, we expanded capacity for care in a number of different ways. As the pressure for COVID care within Ontario continued to escalate during wave 3, we expanded critical care capacity at HHS by nearly 45%. This required redeployment of staff to some of our hospitals and scaling back on services in other areas to free up the necessary people to do these jobs. Several months ago, we were asked to stand up one of 2 mobile health units in Ontario. Once again, this was a multi-team effort with collaboration from many different partners to bring this to fruition. On a more permanent note, our team is thrilled to have received delivery of the new CT scanner at West Lincoln. This is part of our transformation efforts to renew, maintain, and manage the use of diagnostic equipment needed to help inform our patients' decisions about their care. This month, we're also highlighting HHS's 2021 environmental report, and just a shout out to Kelly Campbell and her team for all of their work on this and all of their work to help us progress towards sustainability. As you can imagine, our PPE requirements this year meant that we were using a lot more masks and other items to help protect our patients and staff. In spite of this, we still diverted a significant amount of waste from landfill. So really grateful to our team's ongoing efforts to conserve resources and green up our hospital. Next slide. So I just encourage you again to take some time to visit our community report website and explore the online version of the community report, including videos and other materials. As I said at the outset, I think we've got a lot to be proud of when we look back on all that's been accomplished this year. I especially want to thank Aaron Levo and his team for the fantastic work they've done putting the report together this year. It's always a challenge to encapsulate highlights that represent the breadth and depth of the work that happens across HHS. My sincere thanks to everybody for your commitment and contributions towards what's been achieved over this past year. I am super proud of the organization. So Aaron, with that, I'm going to pass it over to you.
Yeah, thanks very much, Rob. Very nice way to walk through all that amazing accomplishments for the year. So it looks like we will have some time for a Q&A. I know some have been answered already, and you can check in on the answers and responses using the Q&A function at the bottom of your screen. But one thing I wanted to mention was our ongoing effort. Rob mentioned this at the outset of our time today about the effort for voluntary reporting amongst our workforce of your vaccination status. So incredibly important. And you can, if you have a phone in your hand, you can use the QR code here on your screen right now to make that reporting happen. If you don't have a phone in your hand, and then or maybe you're listening to this on the phone in your hand, you can actually visit the hub to do the same thing. And I know this will be sent out as it has been in the past in today's dispatch. So just pause here for a moment for anyone that wants to use that QR code, and would really encourage you to please report your vaccination status to Employee Health Services so that we have a good understanding of the breadth of vaccination in our own organization. So thanks very much for that. Okay, I think we can move on now to our Q&A. I know that there are several in the function already. Of course, I see Pin Sran with a hand raised, and we'll get to your question in just a moment, unless you've raised your hand in error, which sometimes happens, I know. But just a reminder to everybody, you can type additional questions in the Q&A function at the bottom of your screen. So I think there has been some answered around, again, lots of topics around vaccine and what's going on in that effort. The question here. Okay, so Ken, why don't I open up your question to the group. You're going to get a prompt that will ask you to unmute. So you can go ahead when you're ready. Okay, seems that we always have that recurring issue. You would get a prompt on your end to unmute and you can ask your question, but it doesn't seem to be working. So I will move away from that. There is a question here about how the vaccination status information is being used. I know maybe I could call on one of my colleagues. I'm not sure who's in the panel. If we have Susan Fucciarelli from Employee Health Services with us today, or if someone else can maybe jump on that question. Michelle, I see you've come on camera. What can you tell us?
Hi, Aaron. Yeah, Susan is away, so hopefully she can give a more fulsome answer when she's back next week. We've given her a whole week off vacation. But right now, we really are just using this data to gather input on our staff and physicians at HHS. I can tell you that it's in a secure system in Cordy, used only by Employee Health Services, not others having access to that personal data. Personal health information, but we are just looking at it to be able to provide overall stats on our vaccinations, 1 vaccination, 2, or none, as per the slide that you showed earlier. But we can ask Susan to come back and share a little more data.
Yeah, for sure. And I think we have outlined some of that on the hub, so would encourage everyone to check that out. And I think you could learn a little bit more about what the intent is and how the information is being used there. But that was a great summary from Michelle. Another question there, Q&A about mandatory vaccination, which I know has come up before. I'm not sure, maybe Dr. Mertz, if you could give us some insight on, where does that fit in our overall infection prevention and control paradigm? Why might the government not be able to enforce mandatory vaccination for certain workforces?
The question is really above and beyond of our decision making. I think that's the key piece here. As a hospital, I understand we are unable to mandate the vaccine, but it's in the works. The Ontario Hospital Association, I understand, is in conversations around this. If you ask me as an infection prevention and control individual, of course I want every single staff at HHS being double vaccinated, hard stop. Whether mandates is what we need and the way to take, that's to others to decide. But I don't see a good reason why we would not be able to achieve 100% if people were willing.
Good stuff. Thank you for that. Another question here about if the information is anonymous, and I believe, yes, it is anonymous. So there, but again, all of the details are on the hub. So I would encourage people to take a look at that there and fill out that survey. So thanks very much. Okay, so I don't see any more questions coming in. I'm going to suggest we move to our celebrations portion of our agenda, which is always my favorite portion of the agenda because we get to hear some shout outs to people for the work that they're doing, for things across the organization that are exceptional or worth regarding upon. I know I want to say, Rob gave a shout out to me and the team around the community report. I really want to highlight the work of Lillian Badzioch on the team, who really took that concept to heart this year in trying to effectively mount a community report and figure out a way to capture so much. And I know that there's probably stuff left on the editing room floor that isn't in the final report, and that was the challenge of that. But I think she and some of the comms team did a really great job working with everyone around the organization to get that done. So thank you, Lillian, and to the rest of the team that worked on that.
I might give a shout out to our board of directors. We had our final or our annual general meeting just last week, and have a new chair, Mr. Dave Lazzarato, who I'm really looking forward to working with, and said farewell to our outgoing chair, Charles Cremonesi. But I would just say, Charles and the whole of the board have been a really great board of directors for us throughout the pandemic, being very supportive of all that's gone on. So I think we're very fortunate to have such a strong board that's so supportive of the mandate and the mission for us at Hamilton Health Sciences.
Just a reminder to all of our panelists, you can raise your hand, and our attendees, you can do the same, and we'll call on you to give your shout out live. You can also type something in the chat function, and Rob or I'll read it out. Leslie Gauthier, I see you've joined us on camera. What would you like to celebrate today?
Yeah, happy Thursday, everyone. So yesterday we saw some data around the number of patient and family complaints that have been in the last year. And overall, the number for peri-op in particular, or diagnostic procedural work, has been exceptionally low. And I say that with a big thank you to all of our surgeons and the administrative offices that have been managing those conversations with patients. And I really appreciate, I think people have done a really awesome job of helping our patients and families understand the reason for postponement of care. And it's reflected in those numbers. So a big thank you to the administrative supports who do most of that heavy lifting with families. So thank you.
Thanks, Leslie. Just a reminder to everybody, you can type a celebration into the chat function and we'll read it out, or you can raise your hand and we'll call on you to give that celebration live.
So Aaron, I see a thanks from Kelly O'Halloran. Thanks to the executive team for hosting the town hall meetings. Have heard from many staff that they appreciate the information provided and the opportunity to ask questions. We also like the shout outs and a shout out to the CPHS team members involved with all the congregate setting and SHF work done since the early days of the pandemic. Thank you to that team.
Amazing. I also see one here. Congratulations to Dr. Mertz on receiving the Medical Advisory Association President's Award. Very proud to have you with us at HHS. I think for sure, Dominic, well-deserved, and thank you for all the effort you've put into making these town halls a success and keeping everyone informed. Okay, well, I think we're drawing to a close. Just a reminder to everybody, as part of our Star Month celebrations, you can also send words of thanks and gratitude using the e-cards available on the hub. Would encourage you to give that some thought and try and recognize your coworkers, your boss, someone in the organization who's helped you do work, and let them know how you feel. It's always nice to receive. So for closing remarks, Rob, over to you. See you next time.
Thanks, Aaron. And yeah, I'll just say briefly, I hope folks sort of felt the same sense of accomplishment after looking at all that we've been through over the past year and all that we've done. So really amazing response from an amazing group of people. So I know I can speak on behalf of the whole leadership team in saying thanks to everybody for all of the hard work. And from me personally to the executive team, could not have had a better group of people to work with over the past 18 months. So we're just entering into the main of the summer, and would encourage everybody to make sure that you take your vacation. We all, I think, are ready for a break, and that the place can get by without any single one of us because we've got such a strong team. So I think that's really just a good form for us to, take some time for ourselves and rejuvenate, regenerate. So we're off until July 8th, and I'll see you all at the July 8th Town Hall. Cheers, everybody.